Let me get a show of hands. Who in here knows somebody that has been or is currently in active addiction? Now it's about what I'd expect the majority of the room. This has become a complex problem in our society, but the solution is actually very simple. I say simple, but not easy, so bear with me and buckle up. There were 48.5 million people in the United States aged 12 or older in 2023 that were struggling with a substance use disorder and therefore in need of treatment. This is the same as the total population of Oregon, Tennessee, Minnesota, Nevada, Colorado, Oklahoma, and New York combined. Now, I'm one of those people. I've been sober since August 5th of 2012. But just prior to that, I had woken up one morning and I was coming out of another alcoholic seizure in my sleep. The sheets were soaked in this cold sweat. I couldn't get warm. I was shaking, like this uncontrollable, like bone rattling shaking. My skin was turning this weird shade of yellow. And so all I could do was curl up in the fetal position, and I was just begging, pleading, and praying to die. But it just didn't come. And that was the cycle. It was like Groundhog Day for me in that biohazard of an apartment that I was in. You can probably picture the one. I had burnt all the bridges with my friends and family, but I finally found one last bit of humility and I reached out to my family for help. And I was fortunate enough that they helped me get into a 30-day treatment program out in California. I figured I'd go do 30 days in rehab and then I would be fixed. Because 30 days at the time seemed like an absolute eternity when I couldn't stay sober for longer than 2 hours. So I go out to California and I do my 30 days in rehab and I get out, and by that point I'm barely detoxed, but I get myself into a sober living house. The thing was, though, in those early days of my sobriety and sober living, I actually hated myself more than I did in my active addiction because I couldn't numb the pain anymore of feeling uncomfortable in my own skin. Now, that's about the time that this group of men in recovery took me in. And this group of men, over the course of 2 years, didn't just show me how to stay sober. Yeah, we did 12-step work together, and I learned how to be vulnerable in front of a group of men. But what they really did is they taught me how to show up, how to be a man of integrity and accountability, how to build real relationships. The biggest thing that they offered was this exposure to an entirely new way of living and how to have some fun in the process. You know, I figured when I got sober that my days of having fun were over, and they just kept telling me that we didn't get sober to live these small, boring lives. We should be having a good time with the second chance that we've been given. Now, meanwhile, though, I watched as the majority of the people around me that I had gotten sober with and gone through treatment with started to relapse. And they'd be back out on the streets, and they'd be overdosing and dying, and I didn't understand why. So I just buried myself in closer to the safety of the pack. And I couldn't see it at the time, but over that 2 years, what those men did for me was fill those gaps where everybody else has fallen off. And over the next 8 years of my recovery, I saw that same cycle play out repeatedly, both in my personal and professional life, which eventually led me to this place of frustration and desperation where I established a nonprofit aimed at filling these gaps in the system. So what are the gaps? Let's go there. Well, 51% of Coloradans who are struggling with a substance use disorder said that the fear of what would happen if someone found out was the leading reason that they didn't ask for help. That is the stigma of addiction. It is a lonely, dark, and debilitating place to be. And I know that because I was stuck there for a very long time. It's the first gap. Just getting somebody past the barrier of feeling safe enough to reach out and ask for help and letting them know that there's help available. But then that takes us right into the second gap, which is the problems with the access to treatment. So what you have here on one end is a low-income population that's on Medicaid. And so they have access to some treatment services, but they're limited. Then the next group over is still low income, but not low enough for Medicaid and not high enough to afford private pay or a good insurance plan that would cover treatment. So then what you end up with is the highest needs demographic of people that has the lowest access to resources simply for financial reasons, even if they're reaching out for help. But let's say, though, that somebody does get access to treatment, which only 14% of that 48 million people actually get access to. So maybe that's a 30 or a 60, maybe a 90-day program. And then what? Then they're released back out into the world. But it's typically the same toxic environment that they came from, with very little follow-up, maybe some suggestions for 12-step meetings or classes, groups, maybe a therapist, but no real accountability, support, or guidance on how to rebuild a life from ground zero. You know, it sounds really great on paper to get a chance to start over. And it's another thing to actually start over. So what happens? Well, 85% of people who go to treatment relapse within the first year, and the majority of those is within the first 90 days, which is one of the leading contributing factors to the nearly 200,000 overdose deaths in this country in the last 2 years alone. You see, this isn't the people failing the system. This is the system failing the people. So you might be asking, well, how is it comfortable to go back to active addiction? It seems like it would be a miserable thing to go back to, right? Well, yeah, of course. But remember when I said I felt painfully uncomfortable in my own skin? You see, for as many problems as the drugs and alcohol caused, they were also the solution to my pain points. There was a temporary fix. I knew that it wasn't the long-term solution, but it worked for me in the moment. It was the comfortable known versus the uncomfortable unknown. And I, like many people in our society, developed this behavior pattern over time of reaching for an external solution to solve an internal problem so that I didn't have to address the underlying and root causes of the internal problem. It's the product of living in an instant gratification culture and shows us the paradox of drugs and alcohol. They serve as both the problem and the immediate solution. You see, in this post-treatment gap in the system, people are not being exposed to an entirely new and more appealing way of living for a long enough period of time to become accustomed to and comfortable with it. It has to become real to them. But let's say, though, that somebody does get past that year of sobriety, and they're doing well, and they're comfortable, but they've probably been kept for that year in this sobriety bubble, if you will, where they haven't had to develop all the necessary life skills to make that jump over the last gap into full self-sufficiency. So this is that fourth gap in the space where a lot of times you hear people say things like, they were doing so good, and then I don't know what happened. Well, here's what happened. Newsflash, those of us in recovery, we didn't become addicts overnight. We put a lot of hard work into our addictions. Days and nights and weeks and months and years of hard work into our addictions. It was a long-term process. Recovery is then a long-term process. So we're getting people right to that cusp of self-sufficiency and stability. And then we get complacent. We take our eyes off the ball. We don't help them make that jump. And then we watch when they fall back down through the gaps and into the active addiction cycle. So what happens if this doesn't change? Well, right now it costs the country $740 billion annually in terms of loss of productivity, crime, and healthcare related specifically to substance use. But more than the financial side of all this is the social fallout that we haven't even seen the ultimate impact of yet. In 2022, Johns Hopkins University did a study where they found that the average lifespan of the American citizen dropped by 0.67 years, which is just over 8 months, specifically because of the amount of opioid-related overdose deaths in the country. Not all overdose deaths, just the opioid-related ones. You see, the amount of young people dying due to these gaps in the system means that we are going to have an entire missing generation of people. A generation that will never grow up to have families, careers, build businesses, potentially bring about world-changing ideas. Instead, the families are going to be left with the generational trauma and the fallout with no answers and no solution. This impacts each and every one of us in some way, and it's not going anywhere until something changes. The solution is simple but not easy. In 2020, I established a nonprofit called the Abundance Foundation, aimed specifically at filling these gaps in the system. We first start by getting people into a safe and stable and sober place to land, and then we build from there. Sometimes this means getting them into a detox or a treatment center. Sometimes this means just getting somebody past the barrier of reaching out and asking for help. And here's where we bring in a recovery coach. Now, a recovery coach is somebody who has been through the recovery process themselves and is now certified to use that lived experience to help guide someone else through that minefield of early recovery long enough for that person to believe that they can do it. They provide that exposure to the new way of living the same way that group of men did for me. They hold accountability. They affirm their wins. They provide the resources and advocacy to break through any red tape. They're a role model, a mentor, a resource navigator, a connector to supportive community, and one of those pillars for building the life of purpose and hope. This isn't a quick fix either. This is about walking with someone for as long as it takes to get them to self-sufficiency. They help people begin to develop their why, because when the why is big enough, the how is easy. The main challenge that we're facing, though, is that recovery coaching right now is only accessible through cash pay or Medicaid. Regular health insurance plans aren't covering it, which is leaving millions of people without access to this as a solution. We have to stop separating physical, mental, and behavioral health and start having talks about wraparound health care for people when they're sick and struggling. The most impactful thing that we've been able to create, though, this is cool, is this entire sober community that simply does life together and has fun in sobriety. So in addition to the clinical side of things, the clinical and therapy side, we focus on building relationships through activities like camping trips and bowling and laser tag and movie nights and dance and fitness and art. We throw everything at the wall and we see what sticks. I'll tell you where the real miracles in recovery happen, though. The real miracles happen on Friday nights when we get over 100 addicts together for dinner. Some people have a day of sobriety. Some people have decades. But everybody in recovery is welcome. Here is where we get to laugh and cry and celebrate each other's victories and lift the ones up that are struggling and mourn the ones that we've lost. This is the same safe environment that group of men created for me. And guess what? It works. Because it was never a people problem in the first place. So what can you do to be part of the solution? Three things I need you to leave here with today. Number one, support organizations that are already being part of the solution. This starts on a local level. So look for local organizations that you can support with your time, resources, and finances. Number 2, your vote and your voice matters when it comes to treatment and treatment programs that come up on ballot issues. For those of you that are extra motivated, I know that you're out there, please lobby your policymakers and insurance providers to cover the costs of recovery coaches so this is no longer a burden or a roadblock to the recovering addict. And number 3, the most important thing for you to leave here with today. The person that you raised your hand about at the beginning, they just need to hear this from you. I care about you. I want to see you get well. I may not have all the answers or the solution, but I'm here to listen. We end the stigma and we mend the broken system one person at a time. The light shines in the darkness, and the darkness has not overcome it. I hope I've been able to be that light today. Thank you.